Hey there, viewers! Imagine enduring inexplicable mood swings or waking up feeling exhausted all the time. Although these may appear to be commonplace issues, they may be a warning sign that you are deficient in important vitamins. Although vitamins are essential for maintaining the best possible functioning of our systems, vitamin shortages are surprisingly widespread. The ease with which these issues may be avoided with the appropriate diet and supplements is even more startling. So how can you tell whether your body is requesting assistance? We'll speak about 10 subtle indicators that you could be vitamin deficient in today's video. If you have any of these symptoms, think about reviewing your diet and, if required, seeking medical advice to determine and correct any inadequacies. Also, stick to the end of the video where we will talk about a diet to maintain adequate vitamin levels. 1. Persistent fatigue and weakness. Fatigue is a common main symptom in people with vitamin B insufficiency, especially in vitamins B12 and folate, benign. This fatigue is different from the ordinary tiredness that follows a demanding day. Rather, it's an overpowering, enduring feeling of exhaustion that doesn't go away with rest. The synthesis of red blood cells, which are in charge of distributing oxygen throughout the body, depends on vitamin B12. The body finds it difficult to produce the energy required for everyday tasks when oxygen flow to tissues and organs is restricted, which leaves one feeling generally weak and exhausted. Vitamins B12's effects on tiredness were assessed in 16 randomized controlled studies, including 6,276 individuals, according to a PubMed study. Particularly, one research reported a reduction in idiopathic tiredness. Further important for red blood cell production and energy metabolism is folate, often known as vitamin B. Folate deficiency impairs everything from brain function to muscular performance, since it is essential for DNA synthesis and cellular function. People frequently experience difficulties focusing, mental fog, and a decrease in their previous level of stamina. The risk of vitamin B deficiency is increased in those with underlying medical illnesses or dietary limitations, such as vegetarians, vegans, or people with absorption problems, such as pernicious anemia or celiac disease. Therefore, it is important to check levels and modify diets accordingly. 2. Dry skin and brittle hair. Deficits in vitamins A, U, C, E, or E, each of which has a distinct function in preserving moisturized, healthy skin, can frequently be indicated by dry skin. The synthesis and maintenance of skin cells depend on vitamin A. Aside from that, vitamin C contributes to the manufacturing of collagen, which is an equally significant function. The structural protein collagen is responsible for the firmness and flexibility of skin. It aids in maintaining the skin's hydration and plumpness by retaining moisture inside the cells. In addition to being a potent antioxidant, vitamin C shields skin cells from the damaging effects of pollution and UV radiation, which can dehydrate the skin and cause it to lose its natural oils. Lack of vitamin C causes the body to produce less collagen, which weakens the skin's elasticity and makes it more prone to dryness and early aging. Another antioxidant that supports the preservation of the skin's lipid barrier, which is essential for keeping moisture, is vitamin E. In order to help seal in moisture and stop the skin from losing moisture through evaporation, vitamin E acts to reinforce this barrier. Vitamin E deficiency weakens the skin's protective layer, enabling moisture to leave and leaving the skin dry and more susceptible to environmental irritants, according to research published in the Indian Dermatology Online Journal. 3. Frequent infections. Strong antioxidant vitamin C helps the immune system's numerous cellular processes. It improves white blood cell synthesis and function. The body's initial line of defense is made up of white blood cells, which combat and eradicate dangerous germs and viruses. The effectiveness and longevity of these immune cells decline with low vitamin C levels, impairing the body's defense against infections. An increased vulnerability to infections results from this. Conversely, vitamin D influences both the innate and adaptive immune responses, making it equally important for immunological health. According to PubMed, vitamin D increases immune cells' ability to recognize and eliminate infections more successfully. It also promotes the production of antimicrobial peptides. which natural antibiotics are found in the respiratory tract that help defend against pathogens entering the body. When vitamin D levels are low, this critical immune defense mechanism is impaired, making it easier for infections to take hold and spread. 4. Mouth ulcers or cracks at the corners of the mouth. Angular cheilitis is the medical term for mouth ulcers and corner cracks that frequently occur in people who are deficient in vitamin B and folate, (BINE). Vitamin B2, often known as riboflavin, is necessary for energy generation, cell division, and the preservation of mucous membranes, particularly the oral mucosa. The journal Nutrients states that riboflavin supports cell turnover and repair processes, which in turn helps maintain the form and function of the tissues found in the skin, eyes, and mouth. The lips and mouth's lining cells do not renew as quickly when riboflavin levels are low, which can cause ulcers, fissures, and a general deterioration of the sensitive tissues. Further, vitamin B6 plays a role in protein metabolism and the production of neurotransmitters, which are important for overall cellular function, including in the skin and mucous membranes. A deficiency in B6 may lead to inflammation of the lips and tongue, creating an environment where ulcers and sores may easily form. 5. Bleeding gums. Because the gums are made of soft tissue that is highly vascularized, they have an abundant blood supply that aids in tissue repair and maintenance. Gum tissue is kept hard and teeth anchored by the collagen fibers in the gums. The formation of collagen is hampered in the absence of sufficient vitamin C, weakening the blood vessels and connective tissue that support the gums. This might cause the gums to enlarge, become painful, and become inflamed. Moreover, plaque, a sticky layer of bacteria, builds up on teeth and irritates the gum line, causing gingivitis, an inflammation of the gums. The body finds it difficult to fight off the germs that cause gingivitis without adequate vitamin C, which weakens the immune system and guards against infections. As a result, bleeding gums and gum health deteriorate. The severe type of vitamin C shortage known as scurvy emphasizes how important this vitamin is for healthy gums. According to Frontiers, scurvy patients may have severe gum tissue weakness, which can lead to teeth falling out and loosening, as well as excessive bleeding from the gums without any provocation. Even while scurvy is uncommon in modern nations, minor vitamin C deficiency is more frequent than most people believe and can still lead to serious gum problems. 6. Vision problems, particularly at night. According to guidelines from the World Health Organization, vitamin A insufficiency frequently results in night blindness, a disease in which vision becomes noticeably reduced in dim or dark environments. Vitamin A plays a crucial role in the production of rhodopsin, a protein that is essential for seeing in low light. The rod cells of the retina, which are in charge of detecting light and enabling night vision, contain rhodopsin. Low vitamin A levels impair rhodopsin synthesis and regeneration, which makes it harder for the eyes to shift from bright to dark environments. Night blindness is characterized by impaired eyesight in low light and a delayed adaptation to darkness. A vitamin A deficit affects more than simply rhodopsin's metabolic activity. The conjunctiva, a thin membrane covering the white portion of the eye and the inside surface of the eyelids, and the cornea, the transparent front portion of the eye, both depend on vitamin A to stay healthy. In order to preserve good vision and protect the eye, the cornea and conjunctiva are both essential. Insufficient vitamin A can cause these tissues to thicken, dry up, and become more vulnerable to injury, which would further impair vision. Due to its fat-soluble nature, vitamin A is absorbed only through food fat. As a result, deficiencies may result from illnesses like Crohn's disease, cystic fibrosis, or liver diseases that impede fat absorption. Additionally, people who consume low-fat diets or have malabsorption issues may not be getting enough vitamin A, putting them at risk for vision problems. Vitamins are essential for the body's overall function and well-being. When you notice any of these signs, it's important to take them seriously and consult with a healthcare professional to identify the specific deficiencies and create a treatment plan. Addressing these deficiencies not only resolves these symptoms, but also significantly improves the overall quality of life. Thank you for watching, and don't forget to subscribe and hit the bell icon for more health tips. See you in the